Well, you know what? Maybe we could I'll start with the introduction.
Yeah,
And
sure.
if Gwen joins us, that's great. Yeah, does that sound okay?
Sure, please.
Okay. Well, welcome everybody. Thank you guys for attending. And to my knowledge, it's been a long time since we've had a continuing education specifically for our prenatal team. And the first time that I've been on something where Baby's Best Start and us were supposed to meet together. So hopefully we can do more of that in the future. And also just to acknowledge that Brian Geeg also, supported this workshop. So he's Best Start. So thanks to him. Should do. Usually we start each of our presentations with homeland of Treaty 4 and the traditional homelands of the Métis people, and just to be present there. And then also to introduce Jan, our speaker. I got to hear her on I believe it was a Zoom presentation that SASC Prevention Institute put on last fall, possibly. I'm trying to remember when
Sounds
it was.
about right. Uh-huh.
Yeah, and what I really enjoyed about it that I felt was maybe a gap in our, my own skills, I guess I should just speak for myself, is really providing some skills to help the postnatal parents, especially in the areas of sleep and feeding that I wasn't as comfortable with. So I really appreciated and was about your training. So I'll just introduce Jan and let her take it from there. Practitioner and a lactation consultant with decades of experience in primary care and lactation support. She's a published author and an international educator. Jan was honored as the North Carolina Maternal Child Nurse of the Year, the 2020 American Nurses Association Innovative Nurse of the Year, and one of the 2021 Great 100 Nurses of North Carolina. So we're pretty honored that you're with us. And one of the things I really thought was kind of interesting that fit with us is because we've just gone through this time of, having more difficulty connecting with clients face to face, we have relied a little more on virtual tools. So I think some of your I'm looking forward to seeing if we can use some of your virtual tools as well. And because you're so internationally connected, I think a lot of your pictures relate more to our clients, or at least a diversity of pictures in your resources, whereas some of the stuff we're exposed to has maybe just mostly white people, and that doesn't always work for our clientele. So I'll let you go for it. Thank you.
Oh, thanks, Lisa. Well, and I'm as excited as these little babies are about us all being together today. And I really think the only really criteria I bring to this workshop today is I'm a mom, and remember so well what it's like to be a new parent and wanting desperately to do a wonderful job and yet struggling from time to time. So let's just think about some of the families you might see. For instance, this mother who is saying, "Why won't you look at me? You must not love me or love my breast milk." Or this mother who says, "My baby wiggles and squirms all night long. Let's add some cereal to my breast milk." Or this daddy who says, "She cries more this week now that she's 2 weeks old than she did last week. It must be time to start formula." And what I love about these real life stories is that they are stories of parents who are actually describing normal infant behavior, but they are misunderstanding that infant behavior. And all of us know that it's hard to be a new parent, even in the best of times, and it hasn't really been the best of times with COVID. And certainly in the United States, our incidence of postpartum anxiety and postpartum depression has just shot up, and families are really needing more and more from people just like you and me. So we're going to be thinking about the child development, pediatric, and lactation literature that was used to develop this program, and I believe can inform the work that we do. So I love to begin with the child development concept of what's called responsive parenting. If you want to Google search it, that's the framework that it's listed under. And the World Health Organization, I think, had a really clear way of expressing responsive parenting, where they said that first, a parent has to notice a baby's behavior. Then the patient needs to understand that behavior, and then the parent can take appropriate action. So for instance, that mother earlier on who said, my baby wiggles and squirms all night long, I must need to add cereal. Well, she was in fact noticing a baby's behavior, but she didn't understand it. She didn't understand that that was active sleep, a normal behavior in a baby. And because she misunderstood that, she was going to take actions that were not going to benefit either her or her baby. So helping parents see and notice those behaviors, understand what they mean, so that they can take actions that support that baby's growing and developing. And we know when that happens, that it is really the core of a baby's emotional, intellectual, and social development. And the research is so rich about this. We know that when parents practice this responsive parenting, there is less postpartum depression, more confidence in mamas and daddies, more longer breastfeeding duration, less family stress, and even less obesity in children. And of course, we understand that responsive parenting really is at the heart of breastfeeding, because a mother has to initially be able to read a baby's feeding cues in order to successfully breastfeed. But what's remarkable is that research that's done with breastfeeding mothers as opposed to mothers who don't breastfeed is that the parents actually become more attuned to their baby because of breastfeeding, so that breastfeeding actually teaches the mother how to observe, notice, and understand a baby's behavior. When we look at the pediatric literature, I really loved the work of T. Barry Brazelton, Harvard American pediatrician who passed away just a few years ago, but his two huge bodies of work were the neonatal behavioral assessment scale and his touch points program. So the NBAS just looks really very closely at a baby's behavior. And I was actually certified in this exam back, 30 years ago. And what it does is it looks at actually 28 different behaviors in babies and 18 reflexes. And when they're looking at those behaviors, you're evaluating them on a 1 to 9 scale. So it is like looking really closely at a baby's behavior. And that exam is actually used as a research tool around the world. But what we know it teaches us is how a baby changes in their states and how a baby responds or exhibits a stress response. So his touch points work, though, gives us a different body of information. And what it tells us is that when a baby has a surge in her development, she has this temporary, what we think of as sort of this disorganization in her eating, her sleeping, or her general behavior. So that baby that is just getting ready to crawl, and now after the baby had been sitting very well, right when that baby starts practicing crawling, it's very common that that baby's going to be not eat as well, be a little more grumpy, even wake up a little bit more at night. And this is this basic developmental theory that carries on through a baby's child's development. And the good news is we know when babies are going to have these developmental surges. We know when these are going to occur. And so sharing this with families is going to be really important. Then, of course, the lactation literature has lots to say. And one article I really like is called the Infant Feeding and Practice Study 2, which has been evaluated and studied over many, many decades now. But what it asks the question is, when and why do mothers give up breastfeeding? And what they showed, of course, is that, a mother with cracked nipples with a newborn, she's likely to give up breastfeeding. That 4-month-old who's having a nursing strike that the mother doesn't understand, she's likely to give up breastfeeding. And that 9-month-old who is getting starting separation anxiety and waking up 4 and 5 times at night, if the mother doesn't understand that, she's likely to give up breastfeeding. But what's interesting, at each of those steps along the way, the mother always said, my baby is not satisfied. So what she was seeing was this disorganization in the baby's behavior, but she was misinterpreting it as that the baby wasn't satisfied with her or wasn't satisfied with her breast milk, rather than understanding that that sort of sense of disorganization was because of that change in baby's development. So I love this information. And I also love this big Cochrane report, which said that if we wait for the phone to ring, we might be waiting too long. The idea being that if we don't provide parents with anticipatory guidance, letting them know what is going to happen next, then they are likely to give up breastfeeding before they even give us a call. So listen, Matt, here's a little story I put together for you.
It's 4 o'clock on a Friday afternoon, and a mother with a 4-month-old calls and says, I'm so worried. I think my baby wants to wean. She explains that every time the baby goes on the breast, she'll pull off the breast and look all around the room. Do you think that means she wants to wean?
So that is a very common example of how a baby was exhibiting this sort of disorganization, but the mother was misinterpreting it as information that the baby wanted to wean. And so that's why I'm very excited that Lisa has brought to you the digital parent resource page. And you'll see here the Four Seasons Community Health Center. Hope I have that title exactly right, Lisa. Let me know if I don't. But it is a one page that you're going to be able to link and send the URL to your patients so that they can easily access all of this information. And I'm going to be giving you an examples for the rest of our little time together here of the kinds of stories that would trigger you to want to share this information with the families you serve. So at the top of the page is the 20-minute parent education video, which helps parents understand a baby's behavior. All these resources are available in both English and Spanish. When you pull down a page, you come to a handout because some of your families enjoy reading. They learn best by their style of learning is by reading. And so this is a handout that just describes the main components of that video, and it can be read online or parents can download it. Then the next, as you come down the page, they'll bump into the roadmap to breastfeeding success. And I know that I looked up that 6 of you have already completed the roadmap course. I don't know if all those people are with us today, but Lisa's made it available for you to access the 2 online courses, which I'm so excited about the difference it can make in the teaching we do. And so as we come down the page, you're going to see that that each of the red bold titles we see here, each of them goes along with a 1 to 2 minute video that parents can watch to help them understand what is happening at that time in their baby's life. So for instance, here is the one that talks about those bumps in the road.
Breastfeeding is an exciting journey for you and your baby. But like with any great journey, there can be some bumps in the road. This roadmap will alert you when your baby's surge in development might cause a change in her behavior. Just as baby is about to jump from one stage of development to the next, like from sitting to crawling, she might temporarily be distracted while breastfeeding, wake up more at night, or be a bit grumpy when she works to learn something new. These temporary challenges can be celebrated as proof that she is developing normally. Click on or download the roadmap for tips on how to navigate these important bumps in the road.
So like I said, each of those developmental times in a baby's life, the parent can just click on the link and see this 1 or 2 minute video to help them understand the baby's behavior. As you go down the page, the next thing parents will bump into are our newsletters. And we've been really excited that the newsletters are just kind of short bullet points about what is happening at that time in a baby's life. There are links again, like for instance, this is about a baby's sleep cycles at 1 month. They can click on a link about describing a 2 minute, describing the 2 sleep cycles. Or what I'm also excited about is at each of these newsletters, we have a family story where a family is describing going exactly through the challenges of that time. Like this family with their 1 month, they'll help my baby won't sleep at night. So when they're telling this story of their experience with coming to understand that developmental event. And because we know that music enhances emotional learning, at the bottom of the page, you will find 2 Hug Your Baby lullabies. And my husband is a professional musician. And so he and I wrote some lullabies that teach about child development. And I'll show you one of those lullabies at the end of the presentation today. So what I thought we would do is just be kind of birds high in the sky, taking a big overview of the information on these first year your baby's life. And we don't have time to watch every video, but I want to show some of the ones that I thought would be important. So let's say Miss Eloise comes to talk to you and she says, well, I don't really know if breastfeeding is for me. And of course, that is a common question that a new mother might have. And of course, you are equipped with many ways of explaining to a parent about the benefits of breastfeeding. But you could also say you might enjoy looking at our resource page and understand a little bit more about why to choose to breastfeed. And so when she gets to that page, this is what she'd bump
As
into.
this baby knows, breastfeeding is best for the baby, for the mother, and for her family. But breastfeeding is a very personal decision. Understanding your reasons to breastfeed will motivate you to take all the steps necessary to meet your breastfeeding goals. Which of these benefits of breastfeeding are most important to you and your family? Research confirms that breastfeeding hormones will enhance the bonding experience, help you feel closer to your baby, and decrease postpartum depression. In addition, breastfeeding strengthens your baby's immune system, helps prevent childhood illnesses such as respiratory infections and gastroenteritis, and decreases the risks of lifelong illnesses such as asthma, obesity, and diabetes in your baby. Mothers who breastfeed have decreased breast and ovarian cancer, less cardiovascular disease, and a lower risk for diabetes. They even lose their pregnancy weight more easily. Families with a breastfeeding baby are less sick and miss less work than do families with formula-fed babies. Breastfeeding families have fewer medical expenses and save money by not buying formula. Though babies and mothers benefit from any breastfeeding, exclusive breastfeeding until 6 months significantly increases all these benefits.
And I really find in my practice, and I'm hoping you will find in yours, that presenting a lot of this information prenatally is so important. So you could refer your prenatal patients to this website page, and they could explore the part on why is breastfeeding helpful, and also the video on the prenatal. And of course, during the prenatal time, we want them to reinforce that ideas about why they want to breastfeed, where in the community will they find the support they need, and will they be able to read the baby's body language. So one of the things that's been really important to Hug Your Baby is that we use family-friendly language, familiar language, when we talk to parents about reading a baby's body language. We want to use language that sort of lets us become a part of that parent's world, rather than use that kind of medicalized language that sort of asks the parent to come into more of our medical world. And so I know that some of you might have completed the Hug Your Baby course and have discovered what we call the resting, the ready, and the rebooting zone as a way of describing a baby transitioning during the day from one state to another. And what's really remarkable, there's really good literature about this, that when we name things in a way that a parent easily understands, then they start looking for those things. That parent starts looking for, is my baby in the ready zone? Is my baby ready to eat and ready to play? Or is my baby moving toward that rebooting, that fussing and crying zone? So simply by giving them accessible language, we are enhancing their skills of observation. Then the other skill we really need them, oh, here we are. Forgot I had a little video on that. Yeah, then the next skill we want them to understand is to notice when their baby has a physiologic stress response. But of course, I don't like that language at all. And so I created this language of saying, your baby is sending out an SOS. And an SOS is just signs of overstimulation. It's just a way of saying, Mom, Dad, I need a little help. So what about this mom? This mom is Rochelle. Rochelle says to you one day, oh no, my baby won't look at me. Let me see, and I got this little video here. You can see the mother is working hard to get her baby to look at her, but the baby is looking every place else other than at mom's face. And mother really takes this personally. You don't love me. You don't love my breast milk. I must not be doing a good job as a new parent. And then what we know is the case is that if we can help a parent understand these SOSs, then they can relax and enjoy what their baby's telling them. So this is my favorite part of the video about these SOSs.
The first way babies send out an SOS is with changes in their body's skin color, movement, and breathing. This baby, who was born a few weeks early, shows these body SOSs. See how his face turns a bit red in color? His muscles jerk and shake, and his breathing gets faster. The second way babies send out an SOS is with changes in their behavior, spacing out, switching off, and shutting down. Watch as Jan plays with the baby by shaking a rattle. The baby begins to look like she is staring into space. Spacing out is a sign of overstimulation. This baby demonstrates the second behavioral SOS, switching off, described in the medical literature as gaze aversion. The harder the mother tries to get the baby's attention, the more the baby looks the other way. This switching off is a sign that the baby is trying to manage the amount of stimulation she takes in. Mothers are relieved to learn what this behavior means, and that it is not a sign that the baby is rejecting her. This baby demonstrates the third behavioral SOS, shutting down. Again, we see Jan playing with the baby. Though the baby is momentarily engaged with this play, she soon begins to get drowsy and shuts down as a response to too much stimulation. You can respond to an SOS by decreasing stimulation and increasing support of your baby. Decrease stimulation by speaking quietly to the overstimulated baby. Increase support by holding your baby's hands against his chest or gently swaying him. Putting your baby skin to skin or breastfeeding him will also decrease that SOS.
So I love to share this video. Olivia was one of my patients, and she was a mother that we would really consider at high risk for not breastfeeding. She is a teenager with the father of the baby was not involved with the pregnancy or after the baby was born, and her mother had not breastfed. And in addition, her baby was born early. So all of these risk factors that would make you think that you'd be less likely to breastfeed. But let me let you hear from her this really sophisticated understanding of a baby's behavior, because she came to our little class on breastfeeding and understanding your baby's body language.
I thought it was really special the way that Carson communicated to us as a tiny little baby. And I wondered if you would share a little bit about how you learned to read his body language and what that meant to you.
Yes, when we were talking, you were showing me some of the little signs, like him squinting his eyes, and him like moving his arms wildly and his legs. That means that he's been overstimulated. So we tried different things, like putting his arms close to his chest and swaddling him and rocking him back and forth, and that seemed to help. You could tell the difference between when he's being overstimulated versus when he's just closing his eyes and being calm.
Yeah, I remember. I love that when we talked about this, you said you were going to teach your sister and your mom, and so y'all all were paying so much attention to these little ways that babies communicate. That's great. Yeah.
Babies are very smart, smarter than what we think they are.
Certainly isn't that what we want all parents to think, that their babies are smarter than what we think they are. So about 2 months ago, I got an email from this mother 10 years later, and she is now the executive director of a social services program over at our big university here in North Carolina. And she also, when she went off to community college, she set up a program for teenage mothers. So, you just can never understate the significance of what happens when we teach a parent to understand their baby's behavior, both for that family and for that greater community. So now we get a call from Julia, one of your favorite parents you've been knowing for a lot of years. And she comes in and says, I miss your breastfeeding class. I'm so worried that I won't be able to breastfeed my baby like I want to. And you can reassure Julia and send her again to the parent resource page so that she can learn be reminded of these very basic facts about how can you tell when your baby is hungry and how can you tell when your baby is getting enough to eat. And so, of course, part of that is
Your
to
baby
show
can be
those
your greatest teacher.
early feeding cues.
Watching for early signs of hunger and keeping track of baby's wet diapers and of the number and color of baby's stools will reassure you that your baby is getting plenty to eat.
So the video shows very specifically the feeding cues, bringing the hand to the mouth, wiggling and squirming, sucking their fingers, smacking their lips. So, very specific ways to reinforce this Julia's confidence that she can be the mother that she wants to be. And then when the baby's born, the next video, we won't take time to watch all these today, but I want you to watch them all when you explore your digital page we created for you, which is after the birth of the baby, that the parents can be reminded about how a baby's stomach is really tiny, and that's why they need to eat every 2 to 3 hours, being reminded again about those feeding cues. So that's so important for a family. And then we go 2 weeks later. Remember this, Daddy? Oh no, our baby's 2 weeks old, crying more. Is it time to add formula? Well, we want this family to understand about the normal change in crying patterns of normal, healthy babies. We know that babies start crying a little bit more when they're about 2 weeks old. It peaks at about 6 weeks and then gets better and better. And the reason we want them to know that is that if a family doesn't understand about managing crying, the research is really clear. They are increased risk for adding formula, beginning solids prematurely, giving up breastfeeding altogether, and postpartum depression. So that's why on your roadmap, you'll see down there at the 2-week session, a click to links about understanding a baby's normal crying patterns, and also the techniques of using your voice to calm the baby, bringing baby's hands to chest, swaying the baby, wearing the baby, putting the baby to the breast, or swaddling the baby just a short amount of time. But instead of showing you that part of the video, you can watch it on your page. I thought I would share my Korean-inspired lullaby, because we know that if fathers are empowered with information about their baby, that a mother is more likely to meet her breastfeeding goals. And because that's true, we created this video to help daddies understand how helpful they can be to calm their fussy baby.
My daddy knows how to help when I've lost my way. He holds my hands to my chest, softly calling my name. Sometimes I feel so upset, my face gets red as can be. He helps me settle and rest, smiling calmly at me. If I am fretful or frown, getting ready to cry, he sways me up and then down, singing this sweet lullaby, holding me close to his heart. He helps me get a new start. My daddy always comes through. He knows just what to do whenever I start to cry. He sings this sweet lullaby.
So, of course, we would hope that you would refer your daddies to watch that. We also have some nurses and childbirth educators who show that video as part of their childbirth education class when they're talking about techniques to help calm a baby. And of course, we've always heard the complaint that fathers feel like everything is, developed and created for the mother. So we are excited to be able to help families think about the techniques a father can use. So let's see. Now this mother is talking about her 1-month-old, and listen what she has to say. This is Miss Connie.
I would wake up every time he made a whimper at night thinking he needed to breastfeed. I just was exhausted. I didn't get any more than an hour of sleep at a time, and that was a maximum. He seemed frustrated. I seemed frustrated. We're both crying in the middle of the night.
Now, this is a real time that mothers are likely to give up breastfeeding when they have a 1-month-old and they don't understand the difference between active and deep sleep. And so we want them to understand that difference. So this is just a little piece of the video that helps them think about what these cycles
This baby
look like.
shows us what still deep sleep looks like. Her body is still. She surprises her mother by not responding to any stimulation. There is no movement of her eyes and her eyelids stay shut. Her breathing is deep and regular and she makes no sounds. Every hour or so, a newborn will transition from this still deep sleep to active light sleep. This baby is in active light sleep. Her eyes might flash open. She puckers her mouth, makes sucking movements, vocalizes, and can even smile. But this baby is not waking up. She is just transitioning from her still deep sleep to her active light sleep. In only a few minutes, we observe that she transitions back to still deep sleep.
Okay, so there we are. We're up to 1 month now. So we've talked about that prenatal period, understanding the benefits of breastfeeding, talked about that birth period, helping parents understand feeding cues and SOSs and zones. The 2-week-old normal crying and the 1-month-old who we need to help understand active and deep sleep. And I'm wondering if one of you would share with me something that kind of rings true to you here, something that you think, oh gosh, if I'd had that to share with some families, that would be helpful. Who can share something with me? I'll give you a minute, and then I'll start calling on people. Let's see, Crystal and you guys, there's 3 of you. So which one of you can share a sort of a little aha moment with us?
I think just knowing that the changes at the 2-week mark, because our public health nurses usually go out at that 2-week mark.
Oh yeah.
And we have a lot of moms that are like, I'm done breastfeeding. So knowing that that's just a developmental switch can be really, really helpful, I think.
Yes. And I love that you're recognizing and thinking about how if they knew that ahead of time, that would be reassuring. And so that's why I think that Lisa and I are thinking that if you introduce the family to the roadmap while they're pregnant, when things get weird, they may say, well, what's going on at 2 weeks? And if they, click that before your home visit, they might not have already stopped breastfeeding by the time you get there.
Well, and that's it too. Our public health nurses in our prenatal classes do a really good job at showing moms what's coming at them.
Yeah.
And we even have a mom who didn't breastfeed her first child, who's now breastfeeding her second child, because she came to that prenatal class and she knew what was coming at her. Lisa did some work with her with what to eat and stuff like that. So it was really awesome.
Yeah.
Jan, I just wanted to jump off of what Kate was saying there. I remember at the Prevention Institute presentation, one thought I had, or a question I think I had asked you there, you did a good job of answering it, is, so a lot of our clients do start introducing formula when they start to get feeling like they're not making enough milk around that 1 to 2 week mark. So then do the babies get happier?
Well, it's true that if a baby's crying and you stick a bottle in their mouth and they start sucking the bottle, they often will stop crying for the time being. But they don't get happier. I mean, the research on breastfeeding and bottle feeding babies is that they have the same changes and increased crying at 2 weeks. So some babies are going to cry more and some babies are going to cry less. So I think, the reason I like starting with why are you breastfeeding, helping a parent understand this is normal for babies to be a little more fussy now. Let me help you with skills to help calm that baby. And really, why was breastfeeding so important to you, to always be reinforcing with the mother her reasons for breastfeeding?
Yeah, and I think too, one thing you had mentioned is what some parents get in the cycle of too, is like, okay, they try one formula, baby's still fussy, so let's try another formula, baby's still fussy.
Right. And then 3 formulas later, their milk is dried up. So that's right. So I think we can say to mothers, bottle feeding babies and breastfeeding babies cry more when the baby's 2 weeks old. So let's talk about how to manage the crying, because I know that breastfeeding is really important to you. I've heard you say it's really important. So yeah. Great. Anybody else got a story?
Yeah, I thought I would chime in here too. I really do like the roadmap to breastfeeding successes, and we'll definitely be bringing that into our prenatal classes. And just for the moms to be able to anticipate some of those things that will potentially happen to them, and makes our jobs a little bit easier, going into a situation if they're feeling a little bit heightened, to already have some of that back education.
Yeah, thank you, Jacqueline. And here is a really great piece of news. there was a big Hug Your Baby research projects that was done in Japan with all the materials translated into Japanese with a big control and intervention group. And this study is just being published. It's coming out in the next couple of months, we hope, with a big international journal. And what it showed was that mothers who had Hug Your Baby intervention, and all the intervention was there was a 1-hour class about understanding your baby's behavior, and they gave the parent access to the DVD, and they gave the parent access to the roadmap. And with just that amount of intervention, there was significant increase in parents' confidence about being a new parent. And this is what's really exciting. There was decreased postpartum depression. So they did Edinburgh's on all those mothers, and the ones who had that prenatal education, and it's really kind of a minimal amount of intervention. We're not talking about weekly home visits here. We're talking about just some basic information and giving them the video, giving them the roadmap, less postpartum depression. So this is really profoundly important. And I know all of us have dealt with these mothers who become depressed, and we want to do anything to sort of help them over that. Okay, so let's go along here to the, whoops, I jumped ahead of myself, the returning to work. I know all your parents return to work at different times. Because this mother, how will I ever make this happen? And we have the little video that helps her think about returning to work. But I also want to include it in this video of returning to work about the normal sleep regression that happens at around that 3 or 4 month period. Because I actually just did a big project and writing an article on nursing strikes. So this is so important.
Just one additional thought. The Bumps in the Road video explains that a surge in baby's development can impact baby's eating and sleeping patterns. Similarly, a change in baby's routine may cause a temporary regression in her sleeping and eating. Occasionally, a baby will respond to these changes in routine by suddenly acting like she doesn't want to breastfeed. This behavior is sometimes called a nursing strike. Know that your baby is not trying to wean. She is just expressing her confusion about these family changes. A local lactation specialist can give you advice about how to manage this bump in the road so that you can continue breastfeeding successfully. Just one.
So then at 4-month-old, we know that these babies are going to have some sleep regression when they have the 2 big changes in their behavior. So this mother is saying, oh no, does my baby want to wean? Because what we see is these babies coming off the breast when the dog walks by or the partner comes home from work. And then we also see these babies starting to roll over. And some of those babies just are so excited about this developmental surge that they just start waking up more at night, and mother can worry that she doesn't have enough breast milk or that the baby wants to wean. So here's my favorite little video on that subject.
A 4 to 5 month old is on the way to exciting motor and mental development. Notice this baby's determination, frustration, and then surprise by rolling over. In just a moment, the baby seems pleased with her accomplishment and is ready to explore the world from this new perspective. Rolling over often happens at the same time a baby becomes increasingly aware of her surroundings. See how she pulls right off the breast when she hears another voice? This distractibility is normal at this age. It is not a sign that the baby wants to wean. Instead, it's evidence of important mental development. Mothers learn that breastfeeding in a less stimulating environment often helps the baby settle down for her meal. Babies who are especially sensitive to developmental surges may be energized by these developmental changes and begin to awaken more at night. If a mother does not anticipate these changes, then she might think her baby is hungry and needs more nighttime calories. However, mothers who understand developmental surges can continue the breastfeeding pattern that was working before the changes began.
And then, of course, we want to remind them at 4 months that we are recommending beginning solids closer to 6 months rather than 4 months. And so what about that 6-month-old who is getting ready for solids and has that first very cute tooth come in? One of the things that can happen then is grandma might chime in and say, you better stop breastfeeding or you're going to get bit. Well, of course, what we know from our study of anatomy is that if a baby is properly latched to the breast and he goes to bite, he bites his own tongue rather than the mother. And so, of course, we just remind the mother to be paying attention to the latch with that when that tooth first comes in, because the baby is going to be showing us that she's ready to begin solids. And so if the baby starts to be finished eating, coming off the breast, looking around, then go ahead and take the baby off the breast.
6 months is an exciting time for you and your baby. Baby will get that first tooth and be ready for solids, also known as complementary foods. Don't worry about being bitten when you see that first tooth. If baby is properly latched, she cannot bite you. Just take her off the breast when she is tired, bored, or seems to have had enough to eat. It is important to know that a baby's intestines keep developing after birth. Breast milk contains a protective protein that coated the lining of the baby's bowel as it developed. This process is now complete. That's why many national and international organizations recommend beginning solids at about 6 months old.
And one of the ideas that I have about using the roadmap is that, for instance, if the mother with at 2 weeks looks at the part on helping their crying baby, then we've kind of piqued their curiosity about, well, I wonder what's going to happen at 4 months. I wonder what's going to happen at 6 months. And so my hope is that they would be more inclined to go to those other developmental events and to read or watch the video and read the little bit of information ahead of time before they get into trouble. Yeah, Jacqueline.
Yeah, I just had a question. So when we talk about the sleep regression that happens and they get a little bit, more interested in the rolling over, the increased motor development, that kind of thing, at the 4 to 6 months, what's our advice to our moms, especially during the nighttime, because they might not necessarily be hungry, it's just their developmental progression. So what is our advice to moms when they think they have to get up all the time through the night to feed when it's not necessarily hunger?
Yeah, so the first thing is for them to understand that the baby waking up is proof that the baby is growing and developing perfectly. And then as soon as you say that to mothers, I just see mothers just melt in relief of knowing, oh my gosh, I thought I was doing something wrong. I thought I didn't have enough milk. And then, of course, this is one of those things, if they know that ahead of time, then they might not be as likely to go in and comfort the baby by putting the baby on the breast. They might go in, pat the baby, sing a song a minute, comfort the baby back to sleep. If they come to you because they've already started getting up 4 times at night now, instead of just maybe their usual once at night, this is the technique I use that works really well. I get them to cut the length of time that they breastfeed in half every couple of days. So for instance, at night, if the baby's getting up 4 times at night and the baby's breastfeeding for say 10 minutes at each time, I say over the next couple of days, cut the time to 5 minutes. When the baby's done at 5 minutes, when the baby's had about 5 minutes, take the baby off, pat the baby, and put the baby down. And then what we see over a couple of nights is then the baby is getting less calories at night, so that then the baby can respond more to the mother's comforting. That technique works really well. But of course, what works better is for them to know this ahead of time. And I did this lovely interview with a mother with a 4-month-old. And it's actually, I think that interview's in the roadmap course you're going to watch. But the mother talked with such pride about, my baby's waking up more at night because she's so smart. I can see she pulls off the breast and looks all around. Mothers can handle this if they know what's happening. And in fact, they can be very proud and pleased about their baby's development.
Good, thanks.
Of course, I love this picture. I'm having such a great time starting my solids, this baby's telling us. And, it is a joyful time. And so we want families to have the information they need to not be burdened by a baby who's suddenly up breastfeeding half the night again. All right, now we're up to 9 months old. Oh no, this is when Mindy calls you up. Oh no, my baby used to love to go to daycare, but now every time I take her to daycare, she cries when I leave her. In fact, now when I put her down and just go to the other room to get a cup of tea, she cries like I'll never come back again. So this 9-month-old is such an important time in a baby's life when they are developing what we call object permanence and separation anxiety. And again, this is good news for a family. It's good news because it's proof that their baby has really attached to them. And it's also proof that their baby's mental development is taking the exact surge it should be taking now at 9 months old. And so this is the little part of the video that helps a parent understand these changes.
Though your baby is beginning to grasp the concept that things and people that go away still exist, he still does not understand the idea of time. Now, when you go to another room to grab a cup of tea, baby knows you are gone. He misses you and may start to cry. Though just last week he loved being dropped off at daycare, now he gets upset when you hand him to his daycare provider. Without understanding time, baby cannot figure out when or if you'll ever be back. These surprising behaviors are called separation anxiety, and they demonstrate the wonder of baby's developing brain. The vulnerability baby now feels may cause him to suddenly be more cautious around other people. Baby may get upset when a neighbor comes to visit or when he's taken to the doctor for a checkup. This stranger anxiety is evidence that he is developing as he should. We have discussed before that a sudden surge in baby's development can cause new bumps in the road. Let's hear how a mother experiences her baby's 9-month surge in development.
How did she act that was odd to you?
She had been sleeping through the night, and she started waking up 1 or 2 times throughout the night. Always want me.
Yeah.
And she would cry when I would leave the room. She would cry. I couldn't be out of her sight.
Before that happened, that she was kind of easygoing, and you felt like life was kind of more predictable, and then all of a sudden life seemed kind of crazy again.
Yes,
Yeah.
definitely.
So then life gets exciting at 1 year when the babies start learning to walk. And so Mindy's dad calls you and says, you know what is wrong with our baby? She is on the go all the time. She had been sleeping through the night, but now she's waking up 2 times at night. Really, we thought we were done with this. I guess we better stop breastfeeding. So again, we want them to understand that this profound developmental surge about learning to walk really will trigger this extra waking up at night.
That separation and stranger anxiety you noticed around 9 months has probably calmed down. But just when you notice that baby is more predictable in her eating and sleeping, things start changing again. All of a sudden, baby is learning to walk. Walking is an important and powerful surge in baby's development. You will probably see her pull herself up in bed, but not be able to get back down. You will notice her grand attempts at walking. Her wide-based gait and holding her arms out stiffly help her keep her balance. She will lunge towards you with delight and won't mind if you tumble to the floor. Often, babies this age want to practice walking both day and night. This surge in development may temporarily disrupt baby's eating and sleeping, and even cause her to seem grumpier than usual. As you learned before, these bumps in the road are proof that baby is developing as she should. Remember, if baby has been sleeping for longer periods at night, she does not now need more calories. As you learned at 9 months, you can practice ways to comfort baby without introducing more nighttime feedings. A pat on the back, singing her favorite song, or a cuddle with dad can often settle baby back to sleep. If you need to or want to comfort baby with breastfeeding, you might consider limiting the feeding to only a few minutes. This will reduce the chance of baby developing a need for more nighttime calories. Breastfeeding will certainly continue to provide baby with both nourishment and comfort for months ahead. Now can be a good time to introduce a bedtime toy, sometimes called a lovey. If you hug and kiss the toy before giving it to baby, the toy will remind baby of your love and attention. Holding the lovey as you breastfeed during the day increases the ability of that special toy to help baby settle down at night. Can you believe it? Only 12 months ago, you welcomed your baby into this world. What a lovely journey you've had, learning to understand, care for, and breastfeed your baby. You have learned to look closely at baby's behavior, to consider how baby's development impacts this behavior, and to know when to ask for help navigating any bumps in the road. Celebrate all you have learned thus far as you continue traveling the road to breastfeeding and parenting success.
Have any of you ever used a Lovey, help families learn about using what we call in America a Lovey? Do you use, anybody in Canada use that terminology? So Dr. Brazelton taught me this trick. It is really cool that by incorporating using like a one little stuffed animal when mom breastfeeds at around that 9, 10, 11 month time period, then the baby associates the cuddliness, the lovingness that she feels with mom when she's breastfeeding. And then when we're trying to help the baby resettle at night, we can give the baby back that lovey and help, and that really can reinforce for the baby that sense of security and love. It's really a lovely way to help families transition through this developmental time. So my point about all of this is that mothers can be superheroes. You know, they are doing such an amazingly, at times, difficult job of being a breastfeeding mother. We want to both celebrate the baby's growth and development, and by doing that, we're also celebrating how wonderful the mother is for the work she's done to support her baby's growth and development. So let's see, I'm ending this part of our presentation with the end of this story about the, oh no, what about my baby?
Do you think that means she wants to wean?
Now let's return to this worried mother, the one who called you at 4 o'clock on Friday. Now you can easily send her a link to the Roadmap to Breastfeeding Success information and point out the video on the normal distractibility of a 4-month-old. You can also show her where to read the 4-month-old newsletter about a mother who faced this same problem.
Oh, your baby's not ready to wean. Both you and your baby love breastfeeding.
You just helped this mother meet her breastfeeding goals, and you did it in just a few minutes.
So I think that's sort of a real life dramatization of how you can use this digital parent resource page, which Lisa's made available for you, to both help mothers when they call you with a particular problem, but also incorporating it into your earlier prenatal and early baby teaching so that parents can anticipate and know where to go for information about their baby's changing development. Yeah, Lisa had a question.
Yeah, Jan, I was just wondering, since a lot of our moms aren't able to continue breastfeeding too long, are there some of these videos called a map for breastfeeding success that could still work with the formula feeding parents? Like I'm thinking some of the sleep ones or.
Yeah, and you know, I often get asked about that. And when I developed this program, I really was hoping to meet a real gap in what was available by giving families who are wanting to breastfeed information about child development. So yes, I think that it is true that that all of this developmental information is there and would be pertinent to bottle feeding mothers as well. Of course, my hope is that by providing this information while they're pregnant, and that will demonstrate to the mothers that you're going to be there to help them through this process, that even more of those mothers will choose to breastfeed. We had a big program in New Mexico where they began using the Hug Your Baby. They were our first state to train the providers and offer these materials to the mothers. And they really did notice a significant increase in their mothers choosing to breastfeed. But they were quick to say that they were not able to control for the important other variables that might have contributed to that uptick as well. So we're hoping that someday someone will do some research and help us with that information. So let's see, we just did review then the 4-month-old with that surge in development, a real common time to have that sleep regression and some nursing strikes. That 6-month-old getting a tooth and mothers being worried about being bitten. The 9-month-old who's beginning with that separation anxiety and how these babies always start popping up more at night. Frequently, usually what happens is when the babies start popping up at night, mothers start putting them on the breast, and in a very short amount of time, I mean, just in like 4 or 5 days, all of a sudden the baby will be getting so many more calories at night that they'll start breastfeeding and getting less calories in the daytime. This is called reverse night feeding. And we want to prevent them that by helping parents understand that waking up at night is not about calories, it's about development. And then sort of the same thing happening with that 12-month-old. So anybody else have a little aha to share with us about what we've reviewed here? Was that your hand going up again, Jacqueline? Okay, good.
I really like the soothing techniques. I wish I'd known some of those when my kids were little. Or the signs of overstimulation. Like we used to say, oh, our son really likes the fan.
The ceiling fan. Yeah, I hear that all the time.
But I don't think it was that. He was probably spacing out.
Right. Yeah, it's really true. Lisa, I'm reminded of this really lovely story. I was working with this family. They were actually a very anxious family prenatally. And they came to our class about understanding babies' behavior when they were pregnant. And they learned about watching for signs of overstimulation. And when I saw them back at their 2-week-old baby's checkup, the daddy said, sometimes I'll be playing with her. I'm so excited. I just can barely contain myself. But all of a sudden, I'll see her kind of look over my shoulder. And when I see that, I just cuddle her up and put her right beside my neck. And when I do that, I just feel her little body relax. And I thought that was so empowering to this father who was anxious, but he was so empowered by the fact that he could see something and knew what to do about it. Yeah. I hope you'll capture some of these kind of stories of when you start using this material and share them with Lisa and share them with me. That would be great.
I think as I'm growing new into my role with our Healthiest Babies Possible program, just bringing into our prenatal classes the importance of these developmental stages, understanding your baby's behaviors, because I don't know, prior to this course that I probably would have focused a little bit more on the physiological aspects rather than the behavioral developmental stuff. So I really do appreciate that.
Right. Yeah. And when I teach my class, I always about prenatally, I share with my families my bias. I say, we could spend 30 minutes learning how to put on a diaper, but you're going to change 300 diapers the first month of your baby's life. And so even if you're a slow learner, you'll get that down just fine. What I want to help you with is how to feel close to your baby by understanding what your baby is saying to you. So I do feel like this is a real shift for most traditional childbirth education in those newborn baby classes. So I'm excited that you're, Jacqueline, are thinking about that. Yeah. Let me, I know that some of you, 7 of you, raise your hand here if you completed the Hug Strategies course yet. A couple of you did? Good. Yeah. All right. So I know that 7 out of your whole group had. I just want to touch base on a couple of those concepts and then see if you have any questions about that. Well, before I do that, let me hear from you, those of you who, all 3 of you who finished the Hug Strategies class. What would you say about that? Over there in Crystal's room, I think somebody raised your hand over there. What was your response to that online course?
I found that the examples were really good. I kind of utilized one actually in the hospital the other day with one of my girls. broadcasting.
Yes.
So I was trying to get her to go see her baby in the NICU, and so we went to the hospital, or we went down to see the baby, and she was still not really, the bonding wasn't taking place, and given she had only given birth a couple hours ago, I know that takes a little bit of time, but I was really trying to be encouraging her, and so I had remembered what I'd learned about the broadcasting and commentating, and I felt that she was really receptive to that, and I could see how she had settled right down when I was pointing things out to her and showing what she was doing, and she was looking for that reassurance, and I felt that thinking back to the examples that were given, and so that's really what stuck out for me, because I was able to apply it as well, and I saw in my clients some really good results from using that.
Oh, that's great. And who else has finished it so far? I think Lisa. Do you have a comment about your reaction to it, Lisa?
I liked, although it feels awkward, the same as Stacy, the commentating and broadcasting. Partly it feels awkward because I don't know for sure if I'm totally reading the baby well myself, but I'm trying.
Yeah.
And I think it was when I stepped into one of Crystal's postnatal classes. I think she had 3 breastfeeding mothers, and a lot of them were getting close to that 4-month mark, if I remember, or some of them were. And so I mentioned about the distractibility. I just said, do you ever notice that your baby wants to look around more when they're breastfeeding because they're so curious at that age? And I guess the beauty of that strategy is, again, like you're saying, you're kind of entering their space as opposed to saying, I'm the authority and I'm going to tell you what to do. It's more gentle than that. It's a little bit more about their connection. And because attachment is really important in our I guess in our program, I feel like this really supports as you described well, supports attachment. So it's something I will continue to practice. And I think Jen, who is ill today, told me she used it too.
Oh, good.
I'll just relate what I remember of her story, but she was doing a home visit. And she said when she started doing some of that commentating and broadcasting, she felt the mother open up and talk about more things. Like she said, it was a little like an icebreaker, I guess, and help the mom feel more comfortable.
Yes. I just, well, let me just review the quick for those of you who hadn't gotten to the course yet, just so you'll know what in the heck we are talking about when we say broadcasting. Let me just review this real quick because I did have a couple of comments for Lisa. So, how we teach can be as important as what we teach. And I know we've all had the experience where a mother will come in and say something and we'll be thinking, well, I told her all about that. Well, probably I told her all about it in a way that did not really resonate with the mother, which is why they don't remember what I told them, because we have lots of information, right? Look at all this information we have. But what I love to think about is this idea, where's the baby? Where's the baby in the information we share? We're sharing all this information, but what Lisa's just referencing is there a way we can bring their baby into the conversation? And so what we know to be true is that parents don't care how much we know until they know how much we care. And this is what's so profoundly important about these hug strategies. Just as a little background about how they came to be, this was years ago, I was working with a professor of nursing, and she wanted to bring the Hug Your Baby concepts to her nursing students. and we were kind of struggling with how to do that. And she gave me an assignment. She was a kind of nursing instructor. When she told you to do something, your answer was yes, ma'am, and you just went home and did it. And what she
Sorry,
told
just my apologies. Just I just wanted to let the group know I do have to step out into clinic and help down there for a minute.
okay.
So I'll try to come back as soon as I can. Sorry about that.
Thanks, Jacqueline. Sure.
Okay, thanks.
Later. Okay. Anyway, I went home and I got snowed in that weekend out in our cabin in the woods. And the assignment she gave me was this. She said, I want you to go home this weekend and think about I want you to think about example after example of times when you thought that you were really effective in helping a family. And once you think of about 10 or 15 of those different examples, see if you come up with some ideas that were really critical to that success. And so that was how the strategies came to be. So the end of the weekend, there were 3 strategies. The first one being start here, not there, which means paying attention first to the parent's agenda and not our agenda. And always what happens in that situation is expect to be surprised, because when we pay attention to the parent's agenda, what Lisa was just referencing, that it really can be an icebreaker in helping us understand the baby and helping the parent share their story with us. And then next strategy you'll learn about in the HUD course is see then share, which means see the baby's behavior and share that behavior with parents. And what you're being is more specific instead of global or general. You don't say something general like, oh, you're such a good breastfeeding mother. Instead, you say something like, as I'm watching you breastfeed, you're looking down so lovingly at your baby. Oh, I see while you're breastfeeding, your baby reaches up and strokes your cheek. Oh, I see that when you're talking to your baby's eyes go up and watch you. And when you move your head, your baby follows right along. So you are being specific about what you are noticing in the behavior. And what you're doing is what I did for you there was I am at first broadcasting a baby's behavior, which is saying exactly what I see the baby doing. Oh, I see that when you move your head, your baby's eyes move right along after you. Oh, I see that when you're breastfeeding, the baby reaches up and touches your face. So you're just saying exactly what you see. And then I can make more of a commentating is describing the importance of what I see. So, that breastfeeding mother, I can, broadcast those behaviors and then say something like, there's really exciting research that the breastfeeding experience really increases a mother's attachment to her baby. And I can really see that as I talk to you. So that's an example of sort of broadcasting and then commentating. So I have the last one is gaze then engage. And gaze means to look at the parent and assess what you think the parent is feeling. And then engage means to reflect on that information with the parent. And we won't, you're going to all see this online course, but I thought I would show this video that demonstrates a couple of these behaviors. I think, I thought that video was here, but it's gone. I told you the stories instead. Let me say, I wanted to tell you one more story that is one of my favorite stories. I was teaching a family physician residence over at UNC. I was teaching about child development and breastfeeding. And I had this resident, a young person, a new doctor came up to me and says, I'm going to have my pediatric rotation next week. And I am so worried. He says, I don't know anything about children. I don't have children. I haven't been around children. I am really afraid I'm going to blow it over there. And I said, well, now you remember in class when we talked about that broadcasting a baby's behavior, you just go into that room with the parent and you start broadcasting the baby's behavior. And then you tell me what happens. Okay, so 2 weeks later, this resident came running back up to me. He says, "You won't believe it, Jane. You just won't believe this. But my second patient of the day, the other day, my first day in the pediatric clinic, my second patient, I went in and there was a little 18-month-old, and he was kind of toddling around the edges of mom's chair. And I looked down at the baby and I said, oh, your baby is cruising around your chair. I see he's putting one foot down and then bringing the other foot to it. He's reaching out with his hand to support himself. Oh, I see you just dropped this toy." But when he dropped it, he looked down and then he leaned over, still holding on to the chair, and picked up the toy. And the resident said to me, I felt really silly doing this, but I didn't know what else to do. So I just thought I'd practice this broadcasting. So then he said, he went on through the exam, and when he listened to the heart, he just broadcasted, "Oh, I see your little one is yanking on my stethoscope. She's so curious about what's out in the world." So he went through this whole experience. And then what he said was, what I noticed is the more I broadcast, the more I noticed what that baby was doing. And then he said, I couldn't believe it. And when I was just broadcasting the behavior, the mother got the biggest smile on her face, like her baby was the only baby in the world that would reach over and pick up a toy. And then he said, I really couldn't believe this. When the mother left, she went to the receptionist and she said, I want that doctor to be my permanent doctor. And what a great story, because I really find that what Lisa communicated, which is that when we practice this broadcasting and commentating, that it enhances our relationship with that family in such a way that then they are actually more open to the teaching that we may have to do. So of all the things that Hug Your Baby teaches, I must say that hearing feedback from professionals about using these Hug Your Baby strategies is the most profound. That people who've been a lactation consultant for 20 years say, this technique changed my life. That all of a sudden I entered this whole new level of interacting and supporting the families I serve. So I'm hoping to hear some of those stories from you guys in the future. Let's see, I wanted to share one more bit of information about the research that's been done with Hug Your Baby. We have been identified as an evidence-based program by the Healthy Start Epic Center. And there's been a number of research articles that have been published in peer-reviewed journals. These are the ones I thought would interest you. A research project done with mothers in the special care nursery. These are usually late-term infants before they're discharged from the hospital. And those mothers watched the Hug Your Baby video and were identified as having increased confidence as a new parent and increased confidence in going home with their baby. Another project was done with fathers whose babies were in the NICU. And again, it showed increased confidence in their baby's behavior and an increased willingness to talk about what they were seeing their babies doing, which I thought was really fun. Other research projects using Hug Your Baby in childbirth and newborn education showed an increased determination to meet their breastfeeding goals. Research with teenage mothers who just really enjoyed the familiar language. They like talking about zones and SOSs, really felt like they could understand that and would use that with their babies. And then in the US, we have a program called WIC, which is available in all 50 of our states and all the tribal nations in our country. And that research showed that the professionals who completed the program, first of all, the parents who participated in the program had more confidence about understanding about their baby's development. And then the professionals who who completed the course had more confidence in their teaching parents about child development and how it impacts breastfeeding. We've used the program with some nursing schools and midwifery schools, hospital nurses in Japan, parent educators, and also doulas, showing that they have an increase in their knowledge of a baby's behavior and how to teach parents. And then I mentioned before, right at the beginning of the class, we're so excited that this new article is coming out in Women and Birth Journal, the international journal, showing that when families are exposed to the Hug Your Baby material prenatally, that they have increased confidence as new parents and lower postpartum depression. So we are pretty excited about all that research. And I don't know if any of you are connected with nursing schools, but I've had some great collaboration with nursing schools. Are often looking for projects to do with families. And so if you have any contacts with folks that might like to do a Hug Your Baby, a small research project in Canada, we would love to participate in that with you. And finally, I think I mentioned to Lisa, just wanted to let you know that I do offer a once a month Zoom breastfeeding class for free. I don't charge for this. Like Saturday, I've got 60 people coming to that Zoom class because I started doing this during the pandemic because families were just not getting the prenatal breastfeeding education. So I know you have, Jacqueline, I believe, was the one that teaches the prenatal class. But if you have families who would like to attend our class, or I would love to have any of your professionals who would like to attend the class as a way just to kind of get some new ideas about sharing this information with families. And you just go to the Hug Your Baby website to the parent resources, and you'll see there about the prenatal classes. So let's see now. Any other questions here? We're doing really good with our time. Anybody else? I know Jacqueline had to leave and Lisa had to go off camera a minute. Oh, Lisa's still with us. That's good.
If I don't mean to be the one talking all the time, but I did have one question.
Yeah.
Because as Stacy mentioned, you know, she has a client in the NICU right now, but we do get some early births. Would you have any advice for us on the use of these materials with parents who have a child in the NICU or who are, like, I don't know what the earliest we'd see, but I'm guessing we've had some 32, 34 weeks in that.
Mm-hmm. Well, and do you probably have a lot of 36, 37 weekers, yes. Right?
Yeah.
Well, I have just created a program for early babies. So I have a 10-minute parent education program for early babies. And what I'd be willing to do, Lisa, if you guys would collect some feedback from me, is I can go ahead and just insert that into your digital parent resource page so that when you have early babies, you can have them look at this 10-minute video. You know, what's really, really important is this concept of overstimulation of these babies. These babies totally shut down and will not eat when they are overstimulated. And so I did a whole project. I'm actually writing a journal article on this project to help parents understand their baby's behavior with these early babies. So
we'd be happy to take a look at that for you.
Yeah. Well, and if you would, if somebody would make it their business, Lisa, maybe you could think of a way to, when parents, when your folks refer parents to that video, to just somebody give them a follow-up phone call and just let them, you know, try to collect a little bit of feedback about what those families are saying. Because I'm actually meeting next week with a professor of nursing that studies and works with early infants. And I'm going to see if she can do a research project on this material too. So that is a timely question.
And can you tell us what stage of gestation that is geared towards?
Yeah, so we did the program for what we call the late preterm infant, which is that 36 weeker on 4 weeks early. But we're describing it as the early baby because we believe that the material will be important to families with an even younger gestational age. But we did design the program initially with the late preterm infant because so many of these babies are just sent out into the community without information about that baby's development. And I have created a 1.5 hour continuing education program, Lisa, on this subject for professionals. So if in the future you wanted me to present this information to your group, kind of like we did today on this particular subject, we could arrange that.
Thank you.
Great. Okay, well, let's see. Now we're right at the end of our program here. I thought we could end on my other favorite video. This video celebrates the World Health Organization's 10 steps. And we all know that these 10 steps that have been identified to support a mother achieving her breastfeeding goals. And so this is a British inspired lullaby that celebrates these different 10 steps.
Every baby who's born makes a mother's heart warm, born in a circle of caring right from the start. Babies win our heart. In the first hour I get what my mom knows is best, sleeping by mother's hand. I eat whenever I can. Every baby who's born makes a father's heart warm, born in a circle of caring right from the start. Babies win our heart, thriving with father's help. I get just mother's milk if mom must be away. Her milk's here night and day. Every baby who's born makes a family's heart warm, born in a circle of caring right from the start. Babies win our heart. Mothers meet frequently with babies a lot like me. Everyone needs to share all the best ways to care. Every baby who's born makes a neighbor's heart warm, born in a circle of caring right from the start. Babies win our heart. Babies win our heart.
Y'all take care.
Yep. Thanks, Jen.
Bye-bye.
Bye.